We're going to hear from Olivia Munn, who is a movie and television star, and she was recently diagnosed with breast cancer. And she's going to talk about the Breast Cancer Society's online test to check for your risk assessment. And it's only about 6 or 7 questions. You don't have to give them your email, and it can actually give you some valid information. So let's hear what she's got to say about it.
Many women don't know about this lifetime risk assessment test. It's a free online test. It takes minutes. You don't even have to put your email in or subscribe or do anything like that. You answer questions like, how old were you when you got your period for the first time? Have you had any children? How old were you when you had your first child? And it gives you a score.
It also asks you about your family history. It asks you about your ethnicity because that matters as well. And like I said, it's kind of a very quick assessment to do. It asks you if you've ever had breast biopsies before, and it gives you a lifetime risk assessment. My partner did this, and her lifetime risk assessment was only 0.9%. So it gives you a little bit more peace of mind. It doesn't mean you don't need to do screenings, but let's listen to what she got for her score.
Anything above 20% is considered high risk, and then you should ask your doctor to go do an MRI. And mine was 37.3%. So I had the clear mammogram, I had the clear ultrasound. Dr. Alibadi is doing the lifetime risk assessment test in her office right there. She says, you have a really high score. I want you to do an MRI. I thought nothing of it. I thought, okay, just another thing you check off. And then I went in for that MRI, and by the time I got home, I got a call from the radiologist saying we found something.
She was eventually diagnosed with breast cancer. And keep in mind, she has a very unique case. When she says get the MRI is not the first step. But then she later mentioned she had a clear mammogram and ultrasound. So you need mammogram and ultrasound, then we might get the MRI. But it just gives you more information, and you can learn more about your lifetime risk assessment, and it can change the way that you screen for breast cancer. So I get your breast checked once a year, get your mammograms at least every 2 years. We offer thermography in my office to give you another layer, maybe give you the heat signature of an early cancer possibly, and it just gives you more information. So end of the lesson.